This is Lecture 8F. This is the last lecture of the year. We want to thank everybody for listening, and we hope you have all the best of experiences in university. And we urge you all to work really hard in your courses, and one day, perhaps, we'll see you at convocation. Okay, so the topic today is going to be on treatments of psychological disorder once again. And we're going to go through another couple of types of psychotherapy, cognitive and humanistic. And then we're going to discuss when psychological treatment is a good thing, when it's not very effective, and the conditions under which it might actually be quite harmful to people. So these cognitive-based psychotherapies are not interested in unconscious conflicts and motives particularly, and they're not particularly oriented towards figuring out what a person might be, how a person might be rewarded for their maladaptive behaviors. So it's unlike both psychodynamic and behaviorist-based psychotherapies in this way. And the orientation of cognitive-based psychotherapies are that people's problems are really because they don't think right. Their thought processes lead them to develop opinions that are actually lead them to engage in inappropriate behaviors and to be poor in their level of functioning. So this is an important question. How much the way do you feel is because you're irrational or unrealistic in your thinking? And how much of a person's maladaptive behaviors are because their thinking processes are all messed up?
So the first cognitive-based psychotherapy we're going to talk about is rational emotive behavior therapy. And this was developed by Albert Ellis. Now this is a really challenging approach to therapy. Here, the therapist tries to convince people that the way they're thinking is unrealistic or not sensible. So people tend to overgeneralize and catastrophize, and this is part of their problem. So here are some examples. Everyone should like me. I'm not successful unless I'm rich. I'm a failure if this relationship doesn't work out. Doing poorly on this exam means I don't belong in university. All of these are overgeneralizations, and they catastrophize. So instead, the therapist has to challenge these directly. So if someone says everyone should like me, they would say, why should everyone like you? What makes you think everyone should like you? That's crazy. Does everyone like, for example, peaches? No. So why are you different? So it's this type of really directly challenging them in an aggressive way and telling them that they're being unrealistic.
There's another version of this kind of cognitive therapy that's a little friendlier. It's not quite as aggressive in challenging people's belief systems and the irrational thoughts they might be having that are causing them to go wrong. Instead, Aaron Beck's version of cognitive therapy is aimed at just getting people to think more logically without directly telling them just how irrational they really are. So you engage in a kind of, so you think everyone should like you. Well, why do you think that? Do you like everyone? And it's just a much more gentler way to show people how their thought processes might be wrong or irrational, unrealistic. So instead of yelling, you think everyone should like you, that's ridiculous. You know, as Lana was saying, not everyone likes peaches, why should everyone like you? So what makes you so special that everybody should like you? That kind of thing is more the Ellis version. The Beck version, much friendlier. So you can see this is the relationship, for example, between a person's problem thought patterns and their vulnerability to get some mental disorder like depression. So a person might have the tendency to blame all their setbacks on personal inadequacies. They fail a test, they're stupid. They feel like they're stupid. They might focus selectively on negative events. They might get an A on every other thing they did in a term, fail or get a C, let's say, on some one assignment, and they will blow that up all out of proportion, and all of their other successes are not even considered anymore. The only thing that matters is the most negative event that occurs to them. They might make pessimistic projections about the future. Oh, nothing's going to go right for me, nothing's going to get better for me. Or they might draw negative conclusions about their personal worth, so that events happen and they might say, well, I'm a loser, I'm stupid, I'm unlovable, that kind of thing. And all of these thought processes will then make a person vulnerable to getting themselves into that major depressive state.
Okay, for a video demonstration and description of cognitive therapy, see link number 15 in the Unit 8 links folder.
Well, humanistic therapies are a completely different way of going about things once again. They're based on the idea that people naturally gravitate towards psychological health and high functioning. So remember those theories of personality development that emphasized self-actualization, the Maslow's hierarchy of needs. The ultimate goal is to become all that you can be, to reach your absolute full potential. But the main obstacle, according to achieving this heightened state, this ultimate state of a life experience, being everything you can be, the main obstacle is people have low self-esteem. People lack confidence in themselves to be themselves. And as a result, they can't reach this self-actualization objective. So if you give people enough confidence to go about their lives without the threat, for example, of nobody loving them and them being ostracized by the rest of the people in their lives, once people achieve confidence, they can cure their problems on their own, according to this perspective. So then the goal is not really to deal directly with anybody's problems, it's just to make people feel really good about themselves so that they have their own strength to deal with their problems.
So the client-centered therapy was first developed by Carl Rogers, and this is considered a non-directive because it really is focused on the client. They set the tone for the therapy. The therapist isn't telling them how they should feel or how they should think. The therapist really just listens. Okay, so they'll ask questions like, so what do you think about that? Or how does that make you feel? Okay, so it's not their job to judge and provide you with the answers. Instead, they see their job as being empathetic and listening non-judgmentally. And they give you this unconditional positive regard. And that is supposed to make the person feel like they have confidence and they improve their self-esteem. And once they do that, they can improve their lives themselves. And this will make them feel accepted and valued.
Okay, so sort of along the same lines as these humanistic therapies are called existential therapies, and the focus is less on giving people confidence so that they can deal with their own problems. The focus is specifically on life's bigger, broader questions like, why am I here? What is my purpose being here on this planet? So the goal is to provide a context with a therapist in which people can figure out what their life means and what's the significance of the events that have occurred to them. And this all gives them a sense of being in charge of their destiny and a sense that life has purpose. So the therapist's goal then is just to spend a lot of time having conversations with a person, helping them figure out what's the significance of their life and what real purpose do they serve on the planet, that makes people feel good. And the idea is that once you give a person purpose, then they won't have any mental disorder anymore.
So family systems therapies takes a more holistic approach to mental health. So instead of seeing the cause of some psychological problem as residing within an individual, they look at the dynamic relationships that the person is in. So it could be the members of a family. So imagine there's a child who is acting out, has some maladaptive behaviors. Instead of taking them to a therapist who might identify problems in that child's thinking patterns or just in the way they've been rewarded, they would look at how the child feels in these different relationships and how those dynamics produce the behavior. So maybe the child isn't getting enough attention from the parents. There's tension within the family because the parents are fighting, and what does that do for the child? So it looks at the entire family. And the idea is the only hope to improve the behaviors of the one child is to look at the entire family in therapy. So this is also true of couples therapy. So it's how people interact with each other that contributes to their mental health.
Well, in practice, despite there's these various ways of looking at how to treat mental disorder, in practice, clinical psychologists are usually pretty flexible and they adopt more or less what's called an eclectic approach. And all that means is that they take and borrow from any of the different types of psychological treatments that are out there according to what makes the most sense from the perspective of their client and what will benefit them the most.
Okay, well, now we're going to talk about whether or not psychological treatment is scientific. Now, in the use of a lot of psychological techniques, much of the therapy is done without any scientific evidence for its effectiveness, or despite evidence that these techniques are not effective. So often the application of psychological treatments is based purely on whether it makes sense to the therapist and not on empirical validation.
And whether something makes sense and it's not tied to any kind of scientific evidence, whether something makes sense can be quite subjective. Something can make complete sense in terms of a theory about the kind of treatment that you should use to cure some sort of a problem, and yet be completely wrong and potentially quite harmful.
So, as one example of when a therapy makes sense but there's no scientific evidence for it, in May of 2000, 4 people were arrested for the death of a 10-year-old girl. The 3 social workers and the mother of the child decided to engage in a technique called rebirthing. So the idea is an adoptive child doesn't bond with the parent because they didn't go through the birthing process. So the social workers wrapped her in a blanket, surrounded her with pillows, and then the therapist pressed the pillows down on her. And she cried repeatedly that she couldn't breathe. The therapist kept pushing and saying, if you want to be born, you will have to fight or you're going to die in there. The mother watched this from another room on a closed-circuit TV. But they engaged in this therapy because they thought it would be effective. There was no evidence for it. And the girl died. And now they're serving 16 years in prison.
So it can make sense in sort of a way, there's sort of a sequence of logic to it. No bonding. Bonding occurs because of the birth process. We must have this older child go through a birthing process and fight their way out of the uterus. Symbolically, well, there's no reason to think that that has anything to do with bonding scientifically. It's just a story. In this case, it's a story that caused a death. So in the training of mental health practitioners, one thing that's meant to keep psychological treatments quite scientific is that the training of mental health practitioners to appreciate the role of scientific evidence in determining if one treatment is useful and effective for treating some mental disorder or it's not. But the sad fact is there's often little attempt to instill a respect for scientific research as a basis for evaluating treatment methods, at least from the perspective of people that practice, that actually treat clients for mental disorder. Many therapists don't even receive exposure to how scientific research is conducted. And part of the problem and part of the source of that problem is that anybody can call themselves a therapist, even if they have no scientific training. That's not true if anybody is a legitimate clinical psychologist, then they've received quite extensive scientific training. But anybody can say that they're a therapist for mental disorder or mental problems without any training whatsoever. The often less than scientific approach to treating psychological disorders is called a scientific practitioner gap. There's a gap between the people out there that are treating folks with mental problems and mental illness and the people that actually run scientific studies to determine what treatments are actually useful and effective on different types of people.
Okay, so now let's look at the evidence and find out what contributes to the effectiveness of therapy. Well, 1, the client is motivated to improve, meets their problems head on, and they have social support for their efforts. 2, it's the personality traits of the client. So if the client is agreeable and conscientious, they're going to do better in therapy than someone who isn't. And 3, it's the attributes of the therapist, and these would be things such as empathy, warmth, and genuineness.
Well, which type of therapy is best? Because certain types of therapy are going to be better or worse for different types of mental disorder. It's hard to base an answer to that question based on what people say the effectiveness of treatments are for them, because people have placebo effects. They can think it was effective just because they went through the process of getting treated, having nothing to do with the actual treatment itself. And there's also the tendency to justify one's effort, and we talked a bit about this in earlier lectures, that an action seems more effective and valuable to a person if they've expended a lot of effort in the process. So because people put a lot of effort into going through a psychological treatment, there's a strong motive to say that it was effective, even though it may not have been.
Okay, so which type of therapy is best? Well, you must do systematic research in order to evaluate the effectiveness of a treatment. Because like Jason was mentioning, we have to be aware of placebo effects. And also, you don't hear about the people who drop out of therapy or those people who went through the therapy and it wasn't effective for them. So you need to have systematic research. And one way of doing this is randomized controlled trials. So you split the people up into two groups at random, and then one group gets the treatment and the other one is going to serve as the control group. Now, if the treatment group improves more than the control group, then you can conclude that the treatment is effective.
Right, and there's where the statistical significance that we talked about way back in the course comes into play. The treatment group has to improve in a statistically significantly greater amount than the control group for it to be effective. So such research identifies two treatment methods that are most consistently effective. Behavioral-based therapies that we talked about that emphasize changing people's behavior through changing the rewards for their maladaptive behavior, eliminating them, and replacing them with rewards for more productive behaviors. Those kind of therapies have been shown to be most consistently effective, and also cognitive-based therapies that change the maladaptive modes in which people think. But the advantage is not a huge one over other treatment methods. So you can note the effectiveness of each of these types of therapy compared against no therapy control groups. Psychodynamic therapy does pretty well. Anything really higher than 0 shows effectiveness over the control group. So you can show that a number of these treatments are pretty effective at treating mental disorder over no therapy at all, but you see these behavioral modification and systematic desensitization comes out just slightly ahead in this competition. So those are the behavioral-based therapies.
Well, cognitive-based therapies are most effective for treating depression and anger management and problems with violent impulses. So with depression, remember, this would be unrealistic, self-defeating thoughts contributing as a major component of the disorder. So if you can change someone's thinking processes, you can change the effect, so reduce depression. And again, with anger management, its reasoning through problems is incompatible with responding with anger and violence. So once they learn how to modify their thinking processes, then you don't have these responses with anger and violence.
So just to indicate the treatment condition as far as depression goes, the relapse rate, this is the rate of people becoming depressed again after a 3-year period, after they've recovered from an earlier depression episode. And so you can see the effectiveness of medication combined with reliance on interpersonal therapy. And primarily the interpersonal therapy that we're talking about would be these changing the person's thought processes. So you can see that a person just getting both interpersonal therapy and medication combined, their likelihood of relapse is only 20%, whereas somebody who gets only medication has twice a likelihood of relapsing after 3 years. Whereas if somebody only gets that interpersonal therapy with the placebo, their relapse rate is at 60%. So you can see that the combined influence of this kind of talk therapy and changing a person's thought processes, combine that with some antidepressant medication, and that's the best possible scenario or outcome for the disorder.
So, a combination of cognitive and behavior based therapies are most effective for treating anxiety disorders such as phobias, obsessive compulsive disorders, and for problems that threaten health like chronic pain, addiction, eating disorders, and also for treating problem sleeping.
It turns out behavior-based therapy is the most effective method for treating a lot of childhood and adolescent behavior problems because you can alter the rewards and punishments in the child's environment to actually maximize the likelihood that they'll want to engage in positive pro-social behaviors and minimize the likelihood that they'll be naughty, right? So providing consistent rewards for appropriate behavior and consistent negative reinforcement for inappropriate behavior is super effective for dealing with children who act out and have a lot of behavior problems. And also behavior problems associated with schizophrenia can be helped a lot through these reward, punishment, reinforcement schedules. Rewarding only good behaviors can really increase the amount that people with schizophrenia can control their behavior.
Okay, so now we're going to talk about when bad therapists can cause harm. So this occurs when a therapist engages in inappropriate behavior. Examples of this would be when there are violations in the patient-therapist boundaries, such as the therapist engages a sexual relationship with their patient. So this can cause harm. When a therapist holds intolerant or prejudicial views, they cause harm. So there were some therapists who believed that homosexuality was wrong, and they had this intolerant, prejudicial view about it. So they would shock the genitalia of gay men in order to treat this disorder. Okay, so this is, again, evidence of when a therapist's views can cause harm. They cause damage when they coerce a client into accepting their biased explanation of the client's problem. Remember when we talked about dissociative identity disorder, and the therapist would force the clients to accept that they had multiple personalities and that they had been abused as a child. And the fourth one is when therapists use techniques that are known to be ineffective or dangerous, they cause harm. And I already described the rebirthing therapy that was used and ended with the death of a child. But other techniques are when they search for buried memories or alternate personalities with hypnosis. This also causes harm.
And many people, as we mentioned before, were accused of horrific crimes against children that they never committed because people had memories of having been abused in childhood implanted in them through the hypnotic regression process. So therapies can cause harm, unfortunately, in many cases, even though their purpose is actually to help folks. Too many tragic events have occurred as a result of people seeking treatment and then getting badly and incompetently treated as a result. So a person needs to arm themselves as a consumer. Anybody who does experience a psychological problem, thinks they might have a psychological disorder, should take some care and do some research before they go and walk into someone's office seeking treatment. So a person should be a smart mental health consumer, and this just increases the chance that whatever institutions are available, whatever therapies and treatments are available to a person really are ones that will improve their mental health rather than damage it. So as a smart mental health consumer, somebody should seek a fully licensed, well-trained psychotherapist, somebody with a PhD in clinical psychology or who is training within a clinical psychology graduate program and are being supervised by somebody with a PhD in clinical psychology. A person should do research ahead of time about which treatment works best for their problem so that they have a sense of what the science already indicates is the best approach to whatever your problem is, so that you can avoid getting a treatment that is known broadly as ineffective. You should pin the therapist down on how long the treatment should last, so it shouldn't last forever. A person should have a clear sense of about how long it would take in order to reduce their mental problems and increase their mental health. If they say longer than a year, that's probably too long unless the disorder they have is quite severe. So a person, once they do select a therapist to treat them, or walk into a program that's meant to treat their problem, they should commit wholeheartedly to the treatment program and follow it through to the end. So once you've got a good and effective treatment, it hardly makes any sense not to follow through with it if you really do have any serious thoughts about improving your mental health. So another thing to keep in mind as a mental health consumer, keep in mind that life is often difficult and painful, and that some amount of who you are cannot be changed. So a person shouldn't think of clinical psychology as their way to perfection. That you can't walk into a clinical psychologist and expect them to identify all of your flaws and surgically remove each one of them until you become everything that you hoped you would be, right? So that to some extent, life is challenging, and that doesn't equal mental disorder. Just because you feel in pain doesn't mean you have a mental disorder. Just because you're frustrated with your lot in life, that doesn't mean you have a mental disorder. So people can often benefit from finding the strength in themselves to meet the challenges that they face in life. It's really in the extreme cases when things have gone horribly wrong with a person's mental health that they really need to seek the help of somebody who knows a lot about that problem, a professional. But many people shouldn't think that therapy is a way to make their life perfect.
Okay, well, that is the last lecture for the course. We hope you've enjoyed it, and good luck in all your future studies.
Bye.